Hello, welcome to unit number 4. In this unit, we're going to be working with symptoms. In this unit, we have these 4 objectives. The first one is that we're going to learn how to describe symptoms and injuries, then to ask about them, give instructions, and finally, we're going to talk about the SOAP notes. So let's start with the first objective, that is describe symptoms and injuries. And for this, observe this image. As you can see here, we have 6 people waiting in the emergency room. So why do people visit the emergency room? So observe the images here, and I want you to consider the situations that we can observe here. For example, here we have a little kid crying with his mom. Then we have this guy with something in his eye, in his arm. Then we also have another mother with her daughter, and we can see that she's using something here. Then we have this guy, touching his shoulder. Then we have this woman, and we can see some blood here. And finally, we have this couple, and we can see that the guy, the man here is touching his chest. Okay, so what kind of symptoms do these people have? For this unit, we have a lot of vocabulary. Can you identify any of these symptoms? Let's start with the first one. So these red spots are called rash. Okay, so when you have your skin full of these little spots, you will call it rash. Then is this second image, we have a bruising. Bruising happens when we have some purple or red marks in the skin. Now check this poor astronaut. He has constipation. It means that he cannot go to the bathroom. He cannot evacuate. So he's constipated. Now this guy, check. He's coughing because he has a cough. Okay? Another symptom, this guy is itching. Normally when we have a rash, we will finish having itching. Not always, but sometimes. Now this poor boy, observe, he has fever. Okay? Now this lady, poor lady, she has dizziness. Okay? She feels like the movement she's doing with her finger. Now, sometimes soccer players and other kind of players suffer from cramps. It means the movement, when your leg or any part of your body is like frozen, and then it causes a lot of pain. This is the first set. Let's check the following set. Oh, poor cat. He has diarrhea. That is why he's having this poor face. And check, he's saying, "Oh God, poor kitty." Then this hand is bleeding. It is full of blood. Okay. Now this guy, he has just fought, and he has a black eye. Observe his eye. Okay, observe his eye. That is kind of similar with this one, bruising. The difference is that these can appear in whatever part of your body, and in this case, the black eye is only in your eye. Okay? Then, when we're talking about any kind of pain that we cannot really recognize, we can say that it is aching. Okay? It could be your stomach, it could be your head, your back, whatever, it could be aching. Now check this little thing in the finger. It is a lump. Okay, you can have a lump. Also, when you hit, for example, your head, normally you get a lump. Oh, check this poor character. This character is having a running nose. When you don't stop using a tissue, so you have a running nose. Then, now that Halloween is coming, we can see this pumpkin vomiting. Okay, maybe this is not the best idea, but yes, we have vomiting. But before vomiting, normally we feel nausea. Okay, so this is another symptom that people or your patients may experience. But we have more symptoms. Oh, check Dumbo. Dumbo is sneezing, when you have this movement and this situation, you are sneezing. Sometimes when we are sick, we feel really tired, so we suffer from tiredness. Okay? Now, this is a terrible symptom when you cannot breathe and something is stuck on your throat, so you are choking. Okay? Be careful with this because it may be similar to another word, but this one is choke. Okay? Now, if you remember, one of the kids at the beginning in the picture that I showed at first was having this because this person has asthma. Okay? This is kind of similar to Spanish, just check the spelling. Now, poor lady, she's suffering from numbness. It means when your body part doesn't move. Okay? So normally when you hit, for example, your elbow or your knee, you can also suffer from numbness. Then check this poor character. This character has general sickness because he has fever, tiredness, maybe sneezing and coughing, so he has general sickness. I gotta confess that this one was kind of difficult to represent, but I'm quite sure that you understand the idea of an infection, okay? So this is cheese. I know it is not a person, but yes, with this you can recognize an infection. And finally, we have this poor lady suffering from swelling. As you can see, all her body is like very big. So when you suffer from this, you are swelling. So what can you do when you want to know about your patient's symptoms? Okay, so in this case, we have this. Okay, so I want you to check in the presentation, the recording. I won't play it here because the video will last, but I want you to observe this. For example, observe this. Yes, I'm a sous chef at Bessie's Palace. Do you know it? Great Caribbean food. You must go. Anyway, I was working in the kitchens. This morning I cut myself really badly with a chopping knife. I didn't hurt very much at that time, but it sure does now. It often bleeds a lot when I cut myself, but it stops usually. I just can't get the bleeding to stop this time. The knife wasn't very clean, though, and I was worried about the infection. So this description corresponds to this lady. Okay, so what I want you to do is to check description by description in the recording. In this recording, you will find this description, and this description. But I want you to pay close attention to the symptoms mentioned by these people. So here we have, for example, asthma, coughing, asthma again. Here we have, let's see, cuts, bruises. Well, the eye, we can infer that is a black eye, as you can see here. And then in the second slide, we will have the rest of the descriptions. Okay, so please read them and play the recording, okay, for practicing your listening, because in the activities that you will be doing for vocabulary, you will be practicing your listening. So you need to recognize the symptoms. I don't know if you were paying attention to this, but sometimes we were saying blood, and sometimes we were talking about bleeding, okay, or bleed. Sometimes we were talking about cough, and then we were talking about coughing. We were talking about dizziness, and we were talking about dizzy. Why? Well, these are word families. In a word family, we can have nouns, verbs, and adjectives, and also adverbs. But this time we're gonna just focus on nouns, verbs, and adjectives. Just to remember, a noun is a word that names something, such a person, a place, a thing, or an idea. For example, a kitchen, for example, hospital, for example, nurse, for example, love. All of these are nouns. Then we have verbs. What's a verb? A verb is a word that describes actions. This is easy because we also have this idea in Spanish. Okay, a verb could be cut, run, walk, etc. And then we have adjectives, which are words that describe a characteristic of a noun. So adjectives and nouns are linked together. So an adjective could be beautiful, could be ugly, and in the case of the symptoms, could be the ones that I presented at the beginning. It could be bruising, it could be dizzy, it could be, let me think of any other, swollen, okay? So these are some of the elements that we can have in a word family. So, for example, in this table, we can see different families. The first family is blood. The verb will be bleed, and then the adjective bloody. Then we have breathlessness, to be short of breath, and then we have breathless. We have bruise, and then the verb is the same, and then the adjective is bruised. Now observe this family. In this family, we only have the noun and the verb, but we don't have an adjective. In the following family, we have dizziness, dizzy, but we don't have a verb. Then we have infection, infect, infected. In this family, we have pain, painful. Observe this one. Swollen is the adjective, swelling is a noun, and then we have swell, that is the verb. And finally, from these families, we have sickness, to feel or to be sick, and we have no adjective. So with this, you can learn that it depends on the thing that we want to describe. If we're describing something, a person, a place, if we're describing the verb, or if we are describing a characteristic. So, are you ready for the practice?